I am here to formally award the University of Kansas Cancer Center with the prestigious designation as a National Cancer Institute Cancer Center. Congratulations.
It was standing room only in 2012 when then Health and Human Services Secretary Kathleen Sebelius announced that the University of Kansas Cancer Center joined an elite group of 67. Now that countdown continues to Comprehensive Cancer Center designation. Hello everyone, I'm Jill Chadwick, and joining us are Drs. Roy Jensen and Terry Sue. Welcome. Let's start with Dr. Jensen first. Tell us, what has NCI designation done for us?
Well, Jill, it's helped us save lives. And the University of Kansas Cancer Center has outstanding cancer treatment and some of the best patient outcomes in the nation. Patients treated at NCI designated centers have a 25% greater chance for survival. And we have expanded patient access to innovative and cutting-edge treatments and increased enrollment in our clinical trials by over 400%.
Importantly, patients can stay locally and get life-saving cancer treatments without having to travel. They can be around their family and their friends for the all-important support.
We have an example of a patient who is benefiting now from all the doctors described. Meet 17-year-old Emery Langhorn.
On my day 0, I got my cells and my donor cells. And so it's kind of like, I always thought it kind of was like a rebirth in a way, like I'm a new version of me.
Emery's first transplant was at a different hospital, and the cancer returned with a vengeance before 90 days had passed. Here, her doctor says the outlook is much different, thanks to early access to a novel treatment made possible only through the power of NCI designation.
She's doing very well, and we are excited that she will continue to do well. Her bone marrow will recover.
The future of cancer care here includes the goal that no one has to travel outside the state for cancer care, to leave the support of family and friends.
I think that's what is our dream, and I think that can be achieved if we work all together and get our dream of Comprehensive Cancer Center realized very soon.
I'm not there yet, but I can't wait till I can finally say that I'm cancer-free.
Every cancer patient deserves the kind of care Emery is receiving. So where and how do we build on our NCI designation? Dr. Sue.
Well, first we need to identify our top cancer killers in our community, in our region. Cancers that are linked to obesity, human papillomavirus, and tobacco use. We need to focus on prevention and early detection. For example, head and neck cancers are on the rise because of our extremely low human papillomavirus vaccination rates. Lung cancers and other cancers are linked to smoking.
You know, a major problem is education, not only for the public, but for our physicians. And we need to make sure we encourage our patients to participate in clinical trials.
We have a story of a patient who was encouraged to participate in a clinical trial after being told she had 3 months to live.
I had a loving family, grandchildren. My oncologist offered me the possibility of either doing the normal treatment or participating in a clinical trial. After 33 rounds of radiation and concurrent chemotherapy, I had my first CAT scan, and my tumor was gone. It was completely blasted away. I like being an inspiration to other people that just because you have a cancer diagnosis does not mean it's a death sentence.
Dr. Jensen, help us understand the urgency in this countdown to comprehensive.
Well, right now, 1 out of every 2 men and 1 out of every 3 women is diagnosed with cancer within their lifetimes. And if those figures aren't scary enough, by 2030, there will be a 45% increase in the number of cancer diagnoses. On top of that, the issue of health disparities is a very significant one.
Part of our responsibility in being a comprehensive cancer center is for us to understand how we can better reach and treat patients that have cancer in underserved populations.
If you live in rural communities, it might be easier to understand barriers to health care. But for those living in urban areas where medical care is all around us, the issues are often more complicated. Just ask Consuelo Ross, a cancer survivor and founder of Surviving the Odds. We caught up with her at 18th and Vine, what many call the heart and soul of the Metro. and the epicenter of healthcare disparity.
The need is massive. When you look at statistics, just here in Kansas City, we average cancer, overall cancers, not just breast cancers, we average about 27% higher than all of the other demographics as it pertains to diagnosis and death. So there's just, when you look at that, you look at some of our more defined areas like Wyandotte County, where the disparity is so huge, and the 11% in late stage diagnosis for women of color, and you put all that together, I mean, it's huge.
Disparity can also be genetic. And that's where personalized medicine, the future of cancer care, plays a big part of Comprehensive Cancer Center designation. Dr. Jensen?
That's right. Personalized medicine focuses on individual patients and their genetic makeup and cancer type. It's finding the right treatment for the right patient, changing from the one-size-fits-all approach we have been using.
How are we going to measure success?
We're going to measure success like we have been and in the future, in lives saved. We're going to measure it at the Thanksgiving table, on the playground, and in the church pew.
Thank you, doctors. And thank you for watching. The countdown is on.
Hi, Sharon. Good morning. How are you?